What are the causes of IIH? So we have a comment here from Crystal saying that she has IIH, or she's been told that she has IIH. And I would imagine that IIH, based on the symptoms that we're talking about in our other video, would be related to idiopathic intracranial hypertension. So what exactly is IIH? Well, if we break down those kind of three words, we'll start with the last two, the I and the H. So it's intracranial hypertension. This essentially means it's hypertensive. So it's going to be an increase in blood pressure or increase in pressure particularly. And that's going to be just around the cranium, so just around the brain. Idiopathic means that we basically don't know. That it's of an unknown cause. So essentially what that translates to is unknown cause, increased pressure around the brain. And of course, due to the complex nature of the brain, if there's a problem, an increase in pressure in this area, it's not just going to lead to a local problem. It's going to be something much more widespread and systemic, potentially, in terms of symptoms. And it must be known that this is a very particular type of diagnosis. Again, the cause is something we will talk about later. But in terms of symptoms, it's very easy to cross this over with other issues as well. Or there may even be a crossover where there could be more than one thing happening at once. Some of the common symptoms that someone would experience with IIH are things like headaches, like fatigue, stiffness in the neck, the shoulders. It may even start to affect digestion, or they might start to feel more nauseous. And again, because of the complex nature of the brain, and depending where the pressure is on which parts of the brain, it can start to affect some other aspects potentially. This could be things like changes in the ear, such as ringing. It could affect vision, potentially causing double vision or other changes. Or it could even start to affect things like our mood, especially if it's pressing more on that frontal part of the brain. So as mentioned, the cause really is unknown. That's what idiopathic means. Anytime anything is idiopathic, even something like, say, IIH, DISH, other conditions, it also means of an unknown cause. There are some theories behind why it may be happening. One of the big theories for this would be a buildup of CSF in the area. That's what creates this liquid pressure into the area. And this may be due to the liquid not being able to pass, say, fully around the brain or through the neck. And it can also be due to issues with the veins which supply to the brain and the neck. So they may have a buildup of pressure or a buildup of liquid also in that area. But these, again, are just theories at the moment. Nothing is set or concrete. So while the cause is not completely definitively defined, we can start to make some predictions or start to then tailor care for these kinds of patients based on the theories that medicine has provided in terms of buildup of CSF or an increase in pressure due to venous drainage in the area not flowing properly. The first things a medical doctor will be looking for will be if there is high blood pressure, as this can be related and it may start to affect the drainage that's going on in that area. The other thing, in a more physical way, and something we actually look at more here in the practice, is if there is something which may be preventing that proper flow of the CSF, particularly from the top parts of the neck, where the